Hi, my name is Eric Rabel. I am an editor at DocWire News, and today we are speaking with Mike Baird, the president of Customer Solutions at Amwell. The COVID-19 pandemic has catapulted telehealth and remote health into the spotlight, and we wanted to talk with him today about how the pandemic has impacted telehealth and what maybe the future holds. Thanks for taking the time to speak with us today, Mike.
My pleasure.
Great. So I guess my first question is, or what are some of the ways from your seat that telehealth is being used during the COVID-19 pandemic?
Yeah, this has been a very, I've been in telehealth for almost a decade, and I've never seen a period like we're seeing right now. And, while the epidemic has certainly been a very challenging thing from a healthcare perspective, it's at least been somewhat rewarding to see how telehealth can help in a very big way. And so I think there's a number of ways that we see it being played out. Obviously, first and foremost, we want to help with COVID-19 wherever we can, and telehealth's been a very helpful tool set, both to evaluate what we would call low to medium risk patients to see if they have symptoms that would justify them, seeking care in higher acuity situations. But also, and I think more importantly, it's been a very fantastic tool to help the hundreds of thousands of doctors that are not able to practice in their practices right now. And so you've got doctors that want to practice and continue their livelihood, and you have patients that are effectively needing care and aren't able to go to their local urgent care or doctor clinic. And telehealth's been a very effective tool to enable, in some respects, a business as usual setup and enabling care at a very critical time.
Okay. So how are some of your clients or Amwell's clients using telehealth to navigate their COVID operations and deliver, that high quality care?
Yeah, I think what's great about telehealth is it's not limited to a particular set of services. So we see telehealth being used across a broad spectrum of services, everything from very low acuity use cases, sore throats and runny noses, like you would do in any pediatrician's office, all the way up to very high acuity use cases like telestroke. And what's been great about this moment is it's helped a lot of physicians that were probably reluctant to try it before to use it holistically now, because they really don't have any other options. So we see telehealth being used across a wide range of specialties, everything from on-demand services like therapy and psychiatry, weight management, lactation consulting, the obvious, bronchitis, UTIs, things of that nature. And then obviously lots of telehealth being used within the health system, where a more acute use cases like behavioral health or telestroke, neurology, and other services like that. So it really is useful across pretty much just about every specialty. There's not every procedure or setup is ideal for telehealth, but there are so many things where you can do. Even in a surgery setting, do a post-acute follow-up of some sort with a patient to make sure they're doing well, or, a pre-surgery checkup to make sure they're prepared. We think that in healthcare in general, around a third of all visits can easily be done with telehealth. And we're sort of proving that right now, as most doctors have moved the entirety of their practice to telehealth in the short term.
Okay, great. So what has from your chair, what has your company learned during this particular experience? Because as you said, I mean, it is sort of like a once in a century kind of thing here.
Yeah. I've been in technology my entire career, and I've never seen anything scale to the extent that this has. Industries will have rapid growth moments, but in our world, just to give perspective, we're probably up well over 2,000% in a 5 to 6 week period. And so when you think about what that means from a care delivery supply chain, in our world, that's everything from the servers that run the video software to the providers and doctors that we have on our platform that help provide care for many facilities, to the training to get them up to speed, and the credentialing needs to be done. There are so many things that have to happen to do that at scale. And I think what this has illustrated, we're very fortunate to be one of the largest providers of telehealth in the United States. we're fortunate to serve, over 2,000 hospitals, 55 health plans, and that scaling in many respects was built in long before this ever happened, and it's enabled us to rapidly expand to meet that need, albeit not without some difficulty, right? As you can imagine, when this first happened, we saw doctors who normally had 1 or 2 patients waiting for them having 30 plus patients waiting for them, and so we had to quickly bring more providers on the platform to meet that demand. And so I think that's been a very interesting setup to watch how quickly partners in telehealth are able to expand their services. I think the other thing that's been key for us is our ability to get new products out to market to meet this need. So 2 quick examples. One is, we quickly launched a COVID module for our health system and health plan partners. So a platform that we could stand up in literally 3 days to give them a telehealth option with a very, very small contract, a 6-month contract instead of our more traditional multi-year contract. And so that was one to help multiple, we had dozens of health systems sign up for that so they could have an option to treat patients very quickly. The second thing that we did was to address the private practice side of the business. And we launched a private practice service in the middle of this as well to address the needs of all those physicians and other clinicians and providers that were suddenly unable to practice in their offices as we all kind of moved to a stay-at-home shelter-in-place model. So those are 2 things that we had to do very quickly, and for the most part, we've been pretty successful in delivering care through that manner.
So in your mind then, I guess are you optimistic that we've kind of have like a future is now situation, and in what ways would this be a look into the future, but it's sort of here already, right?
Yeah. Very much so. We survey patients and providers every couple of years to get their insight on how they perceive telehealth. And last year, when we surveyed patients and providers, about 8% of patients had used telehealth, and about 22% of providers had used telehealth. And both groups, about 2/3, said that they expected that they would over the next 3 years. What's been interesting is overnight, we've kind of hit many of those numbers. I saw a study today by the advisory board that over 50% of providers have now tried telehealth. So when you sort of instantly overnight, double the amount of users that have experienced this, and clearly, we've seen if 8% of patients had used telehealth before, judging by the volumes that we've seen, we're at some multiple of that in such a short period of time. Once people use technology and they become comfortable with it, they really don't want to give it up. It becomes a very useful thing and improves their lives. I think many of the skeptics around telehealth have found that it's a very user-friendly experience. It enables them to treat a wide range of things that, if they've been hesitant to try it and now they have, they can actually see they can take care of their parents with success, their patients with success. Rather. So I don't think we'll see that really go back. If you can imagine, we've had a 1,600% increase in the number of providers on our platform. Mm-hmm. So, if you think of us and all the other telehealth vendors out there signing up all these providers, if you already have an account and you've used it before successfully, there's nothing to stop you from continuing to do so in the future. And so it is a unique moment to sort of rapidly jump 5 years into the future to a place where we see telehealth being used in a widespread manner.
Great. So what are some of the challenges maybe that you're either still encountering in this rapid scaling up or you anticipate?
I mean, one of the early ones was definitely around recruiting providers because so much of that demand quickly shifted to telehealth providers, and we had some significant wait times. Normally, our wait times are in the 5-minute time frame. We had median wait times pushing closer to an hour. That's back down to 5 or 6 minutes today, and that was largely because we had to recruit a number of physicians, not just in our group, but to get our affiliated health systems that use our product. And I think that was perhaps the most interesting, is how many of those health systems quickly went from having 10 or 50 docs on the platform to having 1,000 or 2,000 in many cases providers on the platform. That was a big challenge, as you can imagine. These are people that need to be provisioned, they need licensing, they need some training on how to use the product. In many cases, these are providers that are at home with 3 kids doing YouTube school downstairs, and they don't have a lot of bandwidth. You can imagine there's just a lot of things that have to get in place to do that. But we've seen from this exponential increase in our volume that we've done that successfully, and we've been able to get people online. I think that's been the biggest thing, is having, qualified, trained providers there. When we brought them onto our provider group, so we operate an Amwell medical group, we increased that team by about 180%, where we hired more docs into our practice. We also have to make sure that we check their credentialing, and that's a lengthy process. So we had teams of individuals that we literally moved off of whatever they were doing in other departments to come help with credentialing checks. Those were some of the things that had to be done very rapidly, aside from all the technical things. We're fortunate to operate in a cloud-based architecture where it's relatively easy to scale up, servers and systems, but that doesn't happen overnight. And, those were all things we had to move pretty quickly to do. But by and large, we've been able to meet that demand and help our customers.
Great. That's we're approaching the kind of last set of questions that I have here, but do you think there's anything that we've been discussing over the last 10 minutes or so that you wanted to say that I didn't hit with any of these questions?
Yeah, I think for folks that are interested in telehealth, one of the things that will be interesting to watch is what happens on the regulatory front. So the other thing that's been interesting, for a long time, telehealth has been working hard to have the right regulations in place to make it easier to practice telehealth. And almost overnight, the vast majority of those things were waived to make it very easy, both from a reimbursement side as well as a regulatory standpoint. I think one of the things that we're quite excited about is hopefully to see cement many of those gains and keep them in place. Once we've paid for these things with Medicare, we should continue to do so. We've proven their efficacy, so why stop? We do think that some of those things will probably come back. For example, they relaxed HIPAA regulations around this, so that certain private practice doctors could even use something like FaceTime to talk to a patient. In the long run, that's probably not in the best interest of both the community at large and as well as telehealth providers. But I think the regulatory standpoint has been very interesting. I think this is hopefully will be a blessing in disguise in us advancing the capabilities to do this with more patients and a broader audience. I think it's also just been interesting to see the breadth of use cases, not only for some of those things that I talked about, but going forward post-COVID. I think this has illustrated how important it is to have things for chronic care patients in general. So if you think of a social distancing future where perhaps there's echo booms of this virus or whatever it may be, and as we need to make sure that we can treat patients, they may go into a hospital facility to be treated, but then they have to be monitored post. Telehealth is a very effective tool to monitor patients post hospitalization, to monitor chronic patients for a wide variety of things. So, overall, while this has been a very terrible epidemic and pandemic that we've all experienced, there are some silver linings, I think, for this industry and more broadly speaking for healthcare as a whole. Anytime you have more tools that can be used to treat patients, I think it's exciting for everybody.
Great. That's all I had for you today, actually. So I wanted to thank you for taking a couple of minutes to speak with us. Again, for the audience, this has been speaking with Mike Baird, the President of Customer Solutions at Amwell, which is a large US-based telehealth company. And we've had a great amount of information there. So thank you very much.